Welcome to part 2 of the medical assistant orientation. So at the end of the program, we like to discuss job opportunities. Hopefully by the time that you've gone through some of the class, you would start to see areas where you can fit in as a medical assistant, and you want to do your utmost best in the clinical sites, because many times this site is looking to employ students. While you're in class, we're going to give you a syllabus, we're going to give you a class calendar, and we're going to give you skills checklist where you will be asked to keep track of your skills. We'll teach you the skills, but we want you to have return demonstrations, and we want the instructor to sign off on your skills that you have done in the class. Let's talk about the initial paperwork that you will get at the end of this orientation. So we would want to ensure that you have completed an application and that you have signed your application. Also, we would ask for you to sign your enrollment agreement, and the enrollment agreement pretty much explains the program that you are signing up for, but most importantly, it helps us to understand how you are going to address this class financially. So at the end of the orientation, the assistant will pull you aside and she will review your paperwork with you, and she will also review your enrollment payment information, and she's going to try to have you identify how you are going to make the payment for this class. And so she will ask you to highlight or outline that information on your enrollment agreement, and whatever you write on that paper, that's what we're going to expect. You will also be asked to sign your student disclosure form, and that's a form that says, yes, we have informed you of your orientation, about the catalog, about job opportunities, and all that information, and that would be found on the student disclosure form. So I think we have gone over quite a bit of information for the medical assistant training program, and at this time we will stop the video recording and sit with you to answer any particular questions that you may have and to discuss your enrollment policy and enrollment agreement with you. Thanks very much for attending the medical assistant orientation today.